In this video, we will discuss the top 10 symptoms of fatty liver disease that you need to be aware of. Fatty liver is a condition in which the liver accumulates excess fat. It affects 1 out of every 4 people worldwide. The good news is that fatty liver is reversible if detected early. By knowing what signs to look for, you can get a diagnosis quickly and take steps to improve your liver health. Now let's get into the top 10 fatty liver symptoms. Make sure you don't miss anything important by watching until the end. 1. Fatigue. Fatigue and weakness are commonly reported symptoms in individuals with non-alcoholic fatty liver disease. Research indicates that fatigue affects about 50 to 90% of patients with non-alcoholic fatty liver disease. The fatigue can range from mild tiredness to more severe exhaustion that interferes with daily activities and quality of life. There are several reasons why a fatty liver can lead to feelings of fatigue. The liver plays an important role in energy metabolism. Excess fat accumulation impairs its ability to release glucose into the bloodstream, resulting in low energy levels. Toxins from damaged liver cells may build up in the blood and cause overall body fatigue. People with fatty liver often have coexisting issues like obesity, diabetes, or poor sleep that can worsen fatigue. Inflammation caused by fatty liver disease may also trigger the body's innate immune response and cause fatigue much like that experienced during illness. The tiredness and weakness tends to worsen as the liver disease progresses. Mild fatigue may come and go, while moderate to severe fatigue and fatty liver disease can be persistent. Pay close attention to any unexplained, excessive, and ongoing fatigue. Seek medical attention to rule out any underlying liver issues, especially if they are accompanied by the other symptoms described in this video. Addressing the underlying cause can alleviate debilitating fatigue and increase energy levels. 2. Dark urine and pale stools. Notice anything off about your bathroom habits lately? Pay attention to the color of your urine and stools, as changes can indicate liver dysfunction. Here's what to watch for. Dark urine. Normally, urine is a pale yellow color. But as bilirubin builds up due to a fatty liver, your urine may turn dark yellow, orange, or brown. The darker the color, the higher the bilirubin levels. Pale stools. Stools obtain their normal brown color from bile, produced in the liver. Fatty liver impairs bile production, resulting in pale or clay-colored stools. Stools may also look greasy and foul-smelling due to excess fat being excreted. Research shows about 1 in 3 people with non-alcoholic fatty liver disease have dark urine and pale stools. If you notice either symptom, see your doctor right away. They'll test your urine and stool sample and likely order blood tests and imaging scans to visualize the liver. These changes in urine or stool color indicate problems with bilirubin metabolism and bile production. Keep track of the color of your urine and stools, as they can reveal information about what is going on inside your body. Don't be afraid to mention subtle color changes to your doctor. Catching changes early allows timely treatment to improve liver health and avoid complications. 3. Bruising easily. Do you have random bruises on your body that you do not remember getting? Easy bruising is a common symptom of fatty liver disease. As your liver function deteriorates, it makes less of the proteins needed for proper blood clotting. Deficiencies in clotting factors like fibrinogen and platelets make people prone to excessive bruising from even minor bumps and knocks. Easy bruising typically first appears on the central part of the body, like the chest, abdomen, back, and sides, before showing up on the arms and legs. Bleeding from the nose or gums can also occur. Notice if bruises seem to develop spontaneously without injury or occur disproportionately to the trauma. Large bruises over several inches that are slow to fade may be a red flag. Make sure your doctor knows if you see increased bruising or bleeding. They'll check blood tests related to coagulation and likely order an ultrasound or CT scan to visualize liver damage. Getting treated for fatty liver disease can help improve blood clotting capacity and reduce bruising frequency. In the meantime, Be gentle with your body and avoid activities with high risk of falls, cuts, or impacts. Use caution with over-the-counter pain relievers like aspirin or ibuprofen that can thin the blood and make bruising worse. Your doctor may recommend vitamin K supplements to promote clotting. Increased bruising tends to creep up slowly, so be vigilant tracking any changes. Bruising easily isn't normal aging. Bring it up to your doctor, as it indicates progression of fatty liver problems warranting prompt evaluation and care. 4. Upper right quadrant pain. Discomfort specifically in your upper right abdomen is another common symptom of a fatty liver putting pressure on nearby organs. This upper quadrant is where the bottom of your liver resides, just below your ribs on the right side. Studies show up to 80% of patients with fatty liver disease report abdominal pain in this region. Fatty liver causes the liver to swell with fat, gradually stretching the organ's outer capsule. This stretches nerve endings that convey pain signals, causing sensations of fullness, bloating, and a dull, throbbing ache that gets worse when wearing tight clothing or bending over. The abdominal pain can also spread to the right shoulder blade. This happens when the enlarged liver presses on the diaphragm muscle that separates the chest and the abdomen. When the phrenic nerve, which runs through the diaphragm, is irritated, referred pain radiates to the shoulder region. Patients often describe a dull or stabbing ache in the right shoulder and neck that comes and goes along with the abdominal pain. This shoulder pain happens because the phrenic nerve originates in the neck and has branches extending to the shoulder. Seeing a doctor promptly for imaging tests can confirm if an enlarged fatty liver pressing on adjacent organs is the cause of persistent upper quadrant discomfort. Ultrasounds, CT scans, or MRIs can evaluate liver size and fat content. Treating the underlying liver disease through lifestyle changes and medical management helps shrink the enlarged organ and relieve the abdominal and referred shoulder pain. Physical therapy and nerve medications can also help manage symptoms. 5. Confusion and sluggishness. Having a fatty liver doesn't just affect your body, it can impact your brain too. Many people with non-alcoholic fatty liver disease experience symptoms like brain fog, confusion, and sluggish thinking. This happens because your liver isn't clearing toxins properly from your blood. Ammonia, a waste product from protein digestion, can then build up and enter your brain. Too much ammonia acts as a neurotoxin, slowing your thought processes. Fatigue and lack of energy can worsen mental fog. Your brain relies on the liver to metabolize glucose for fuel. When overburdened with fat, your liver has a hard time properly regulating blood sugar levels. Poorly controlled blood sugar leads to focus and concentration difficulties. Studies show 50% or more of people with non-alcoholic fatty liver disease have some neurocognitive impairment. Symptoms may start subtly, such as having trouble thinking of words, forgetting recent events or conversations, losing your train of thought easily, feeling confused doing complex tasks. Make sure to mention any concerns about memory, focus, or confusion to your doctor. They'll evaluate your symptoms and may recommend supplements that support brain function. Getting treated for fatty liver is key to help clear toxins from your bloodstream and improve mental clarity. Pay attention if thinking seems cloudier than normal. Seeking early treatment helps reverse damage and regain optimal liver and brain functioning. Before we move on to the final 5 fatty liver symptoms, please like this video and subscribe to our channel. Thanks to your support, we can continue to help more people by creating these free health videos. Make sure you don't miss anything important by watching until the end. 6. Loss of appetite. Loss of appetite or feeling full after eating only a small amount of food is another key sign of fatty liver disease. Up to 80% of people suffering from non-alcoholic fatty liver disease report having a poor appetite and feeling full quickly. In fatty liver disease, excess fat accumulates inside liver cells and causes inflammation. This impairs the liver's production of an important protein called albumin. Albumin helps maintain oncotic pressure to keep fluid in the bloodstream rather than having it leak into tissues. Low albumin levels due to liver damage leads to swelling and fluid retention. Buildup of abdominal fluid causes abdominal discomfort, bloating, nausea, and early fullness while eating. Damage to liver cells also disrupts appetite-regulating hormones and other digestive enzymes produced by the liver. Individuals with fatty liver disease may feel full faster, be satisfied with small portions, or have no desire to eat at all. Loss of appetite tends to correspond with worsening liver inflammation and damage. Pay attention if you've experienced an ongoing lack of appetite and rapid fullness when eating for no apparent reason. See your doctor for evaluation. Blood work and imaging can determine if poor appetite may be related to possible fatty liver disease. Treating the underlying liver condition can help restore normal appetite and improve nutritional intake. 7. Unexplained weight loss. Sudden unintentional weight loss is an important symptom that may signal the presence of fatty liver disease. While fatty liver is commonly associated with weight gain, progressive fatty liver that advances to inflammation and liver damage can actually lead to unexplained weight loss in some individuals. This weight loss occurs due to liver dysfunction and loss of liver cells hampering the liver's ability to metabolize nutrients, proteins, and fats. Impaired nutrient processing and decreased appetite from liver disease reduces calorie intake. The dysfunctional liver is also unable to properly regulate blood sugar levels, resulting in the body breaking down fat and muscle for fuel, causing weight loss. The pattern of ongoing, unintentional weight loss of at least 5 to 10% body weight over several months should raise suspicion of possible underlying fatty liver disease. Mild fatty liver usually does not cause weight loss. It's the progressive form with liver inflammation and damage that impairs liver function enough to impact metabolism and digestion. Sudden weight loss is considered a late-stage symptom and signifies advanced fatty liver disease. Seek prompt medical care if you notice unexplained weight loss for a thorough evaluation. Blood tests, imaging, and possibly a liver biopsy can help diagnose severe fatty liver disease leading to weight loss. Addressing the root liver problem along with nutritional counseling can help improve digestive health, liver function, and maintain healthy body weight. 8. Itchy skin. Having an itch that just won't seem to go away despite scratching? Itchy skin, also called pruritus, affects up to 30% of people with fatty liver disease. The itching is thought to result from the buildup of bile acids as liver damage progresses. You may first notice itching located around the palms of the hands and soles of the feet. It can spread to other parts of the body and come and go. For some people, itching worsens at night, disrupting sleep. Scratching only provides temporary relief, and the irritating sensation returns. If itchy skin is new for you or seems to be getting worse, report it to your doctor. They can test your blood to look for elevated bile acid levels indicative of impaired liver function. Treating the underlying fatty liver is essential to address the root of the itching. Your doctor may also prescribe bile acid-lowering agents, antihistamines, or medicated creams to help relieve symptoms. Avoiding hot showers or baths, fragrant soaps, and tight clothes can also minimize skin irritation. Be alert about itchy skin, as it signals potential liver damage warranting attention and care. Don't assume it's just dry skin. Getting evaluated and sticking to your fatty liver treatment plan helps manage annoying itching episodes. 9. Spider angiomas. Spider angiomas are red spots or marks on the skin that look like a spider's web. They are another key external symptom of advanced fatty liver disease. These small spidery blood vessels appear when high levels of estrogens and low levels of clotting factors circulate in the blood due to impaired liver function. In the center of the spot, there is a small reddish-pink blood vessel called an arteriole. Around the central arteriole are tiny capillaries, the smallest blood vessels, that spread outwards like a spider's web. They often first appear on the face, arms, hands, and upper body as the blood vessels under the skin become dilated and visible. Spider angiomas can appear as tiny red dots or grow up to 2 to 3 centimeters wide, or about 1 inch, if the fatty liver disease is advanced. The number and size of these red skin spots indicates how badly the liver is damaged. More and larger spots mean worse liver dysfunction. Advanced fatty liver disease disrupts the liver's role in hormone balance and clotting ability. Spider angiomas thus serve as an external indicator of the internal liver damage. Although a few tiny spider angiomas can happen to anyone, having a lot of large spots bigger than 2 centimeters, or about 1 inch, indicates the need for medical evaluation to rule out fatty liver disease. Treating the underlying liver disease and halting progression of damage can prevent further spider angiomas from forming. However, already formed ones may persist for years even after the liver issue resolves. Laser or electrocautery procedures can remove disfiguring spider angiomas. 10. Jaundice. Jaundice is a yellowish discoloration of the skin and eyes indicating liver trouble. It happens when there's a buildup of bilirubin, a waste material produced by the liver. Jaundice is a classic sign of advanced fatty liver disease. Fatty liver impairs your liver's ability to metabolize and excrete bilirubin. Excess bilirubin then circulates in your blood and deposits in your skin and whites of your eyes, turning them yellow. The discoloration is usually most noticeable in lighter-skinned people. But on darker skin tones, check the whites of your eyes for yellowing. Jaundice is often accompanied by other symptoms like fatigue, abdominal pain, nausea, and itchy skin. See your doctor urgently if you notice any jaundice symptoms. It could mean significant liver damage is occurring, or even liver failure. Make sure to mention if you have risk factors for fatty liver, like obesity, diabetes, or heavy alcohol use. Your physician will run blood tests to measure bilirubin levels and look for elevated liver enzymes. They may order imaging tests like an ultrasound to visualize the liver. Treatment involves identifying and addressing the underlying liver problem. This may include medications, weight loss, and avoiding alcohol and certain medications processed by the liver. Catching fatty liver progression early is crucial before it advances to severe liver scarring and jaundice. Seek prompt treatment for yellowing skin or eyes, as it signals a serious health issue requiring urgent care. If you have any of these top 10 fatty liver symptoms, don't ignore them. Fatty liver is reversible, but early detection is critical in preventing permanent liver damage. Knowing the symptoms discussed in this video will help you identify potential problems and see a doctor promptly. We really hope you found this video useful. Please subscribe to our channel and like this video before leaving. We are able to continue producing these free health videos thanks to your support. Stay healthy and take care. Continue your health journey by watching the recommended videos on your screen. Join the Healthy Factors community by subscribing to our mailing list below.